off shift and heading home. Bergie's Cafe. All the food.
Smell bacon. Smell like
Silly.
I'm gonna eat you.
We're by crossing the railway.
And where is this?
We're in Rady Wide Falls, and this is, we're just gonna cross the train.
A train's coming!
Stop it!
It's a Ryan train. Damage control. I'm gonna say something less dumb. You see the rainbow.
How do you like the Lost Lake?
I feel lost and beauty of it.
We were walking along the bike road, and then we found this little trail that's right next to the water. It's really pretty. Wait for it. Making Shin the lake. Shin Master. Hello, I am just coming off a 11 p.m. to 7 a.m. shift, so right now it is 7 a.m. I saw a lot of abdominal pain today. So diverticulitis, pyelonephritis, like diarrhea. It's a very common complaint. Chest pain, tons of it, which is good. Every time it's like a little bit different. Really admired what my preceptor today was. He's an amazing. He brings really nice energy, so he like makes patients feel at ease. He gives off this vibe of like connecting, a little bit like casual, but the way he explains the conditions is just so good. Just so good. And he always has this really great line that I'm going to borrow now. He's like, if it's an emergency to you, it's an emergency to me. So telling patients like who feel like they don't want to come in because it's, it's not serious, it seems like silly, they're taking up the busy emergency department's time, but it's like better for them to get checked out. It can stop things from getting worse. A lot of times it will actually be nothing, but sometimes something that seems like nothing is actually something serious. So I thought that was amazing. That's the kind of energy I do want to bring in as a physician. I had this great plan, so I just came off of nights, like working like 11 p.m. to 8 a.m. shifts. So I start working at 10 a.m. tomorrow. I realized that working shift work is so hard because I I thought it would be easy. I'd book myself a workout class, I'd go to a cafe, grab some coffee, and adjust. But I woke up too late to make it to my workout class, which I'm really choked about. And then I went to a coffee shop, and I even though I had got an Americano in me, I was just kind of drowsing off. And I think my energy levels are just not where I want them to be. Workout time. It is 3:30 a.m. and I cannot fall asleep. I'm just up. So I finished this much of this book and I think it's amazing. It's about feeling less busy and getting more done. And I feel like there's a lot of principles that I want to incorporate into this book. So one of them is trying to track time. So with vlogging, at least I can track productivity. I always feel like at the end of the day I'm I didn't get anything done, I'm useless. But for example, I would have thought that for today, but I realized actually I did get a few things done. I should get my room all clean. I read the quick infectious disease chapter for pediatrics. And then I did get a good chunk of the book. Me and Ryan are going to the beach for 2 hours.
Nice.
Hi.
Cool.
Hello. I am here yet again outside working on my personal statement and CV. So I think right now what I'm going to do is I'm going to work on condensing my CV. Off shift and heading home. Today I was in first aid, which is like shorter problems, I guess. So for example, lots of like if you get a cut, you need sutures, or you're worried about concussion. So things like concussions, lots of skin infections, cuts. So today I got to do a whole bunch of suturing. So yeah, today I got to do some big lacerations. For example, one of them was like super deep, super wide, and some things that I didn't do well, didn't know how to do, and now I know. My preceptor taught me that, for example, when it's really thick and there's a lot of fat, or there's any like bits of things that can get into the way of the wound coming together closely, which is that you actually have to go in and you have to cut off some of the fat. So like your scissors cut off some of the fat and trim it so that it seals really nicely, and that's painless because you don't really feel a lot when your fat's removed. So yeah, I didn't know that, and now I know that it makes wounds close better. And then the second tip with suturing is a better way to put the local anesthetic. So for me, I was going too deep. So his suggestion is to go right near the epidermis to the surface. So by parallel, he means like this is the wound. I don't know how I'm going to show this himself. Say this strap is the wound. He will go like parallel, like almost parallel, and then go at the just so parallel to the wound, and then just go proximal there. That way you manage to get a lot out. And then when giving the anesthetic to a kid, he likes to use the 30 gauge needle. And for wounds in like high tension areas, with the back, the shins, etc., use a 4-0. He likes using proline most of the time. And then for kids, 5-0. For face, 5-0. And then women like to have 5-0 because it's like less scarring. So good to know for me to choose some sutures. Something I learned today was to treat someone with an STI, you would give them a urine gnat, so for chlamydia and gonorrhea. And empiric treatment is an IM ceftriaxone into the thigh, as well as doxycycline BID for 7 days. I always thought it was azithromycin, like a 1 gram dose, but he said doxycycline for the 7 days is actually better than the azithrom. Something that I want to challenge myself with that I totally blanked on how to do is like a patient came in with a cast. This is something really cool. So if you fracture your radial styloid, not your scaphoid but your styloid, then you can do this thing called a guidate splint, which means you splint these 2 fingers together down the side, and it can be a removable splint. So apparently if it's the first day, use a plaster cast because it's more forgiving and it kind of accommodates the swelling. But any day after that, you can use a fiberglass splint, and you splint it all along this I'm trying to hold this, but basically all along this side. This is the other side. And then I don't know, he like preceptor offered a chance for me to do it, and I just blanked and didn't remember how to cast. And so now I remember you put like a soft, cushy sock, and then you put as a base, and then make sure to cut a hole out for the thumb. When it's a styloid, you don't need to omaz the thumb. He says don't remember to when you put next you put a fiberglass cast over it, so you cast over it twice. Loop, and then you remember to cut with your scissors to free the thumb. Then loop another layer on top, and then you let it harden and dry. A post-shift gym workout today.
Sinh ra hồi xa, 50 sinh ra. Mà lại gần thôi.
Yeah? Hello. I am leaving the emergency department now for today's shift. Today I started at 3:30, and I love the preceptor I work with today, getting like a lot of feedback to help improve. So today's feedback, getting 100% better, is it's really important to practice that summary statement. Okay, in conclusion, this is a 58-year-old female who presents with a 2-day history of grease sensation. Her main complaint is this. Our main priorities are number 1, to treat her pain, number 2, to do investigation to rule out a head injury, number 3, to see how her shoulder, we're gonna have to do something to get her shoulder back in place, or x-ray her shoulder to see what's going on. And then last of all, dispo planning. Boom. Laceration today. They're looking a lot neater and I am getting a lot faster. You know, definitely compared to when I was in 3rd year, and just, yeah, so I need to realize that like whenever I'm disappointed with a skill that I'm not really good at, I have to realize that I'll just get faster and faster. Exciting stuff that I got to do today. I got to help with a central line, so I had the chance to help with putting back a shoulder in today. That was awesome. So like I was like wrenching hard on someone's like arm and then like popping, like basically popping their dislocated shoulder into place, and you actually feel it like give when that dislocated shoulder joint, you know, when it's like out of place, you feel like a little dimple. This is why I preset anatomy. You feel dimple, and then once you pop back in, you feel like it's back smooth again. The emerge docs at this hospital I'm working at are all so nice about like opportunities to teach and kind of getting my hands dirty, so I'm awesome. It's like really exciting to do that. Shingles is a bit mysterious. And apparently, so there's 2 different treatments. You give them acyclovir and valcyclovir, and valcyclovir is more convenient because it's 2 times a day, but it's more expensive. So that was a cool, interesting tip. And so the key point to talk about is, does it follow like a dermatomal distribution, and you can only really get a viral PCR if there's like a blister. I saw a kind of a wrist pain case, and a tip that I learned is remember to always test, palpate for snuff bulk tenderness to make sure there's no scaphoid fracture. However, a distal radius fracture can also be like, that's really close to the snuff box, could present that way. Last tip I got from attending is that if, you know, a lot of patients are waiting and they kind of get annoyed that they've been waiting for so long, is to reply with like, thank you so much for your patience. We are doing our best to try to get to you as soon as possible. Some homemade udon, pork tenderloin. We got some shallow mao. And this is the most truest statement ever.